Hello, everyone. Welcome to Heal Yourself Rather Than See a Doctor. 大家好，欢迎来到看医生不如看自己。Today, let's continue Chapter 18, Lecture 3. 今天我们继续第18章第3个讲座。Mistake from hospital treatment of hypertension. 医院治疗高血压的误区。And how is the high blood pressure treated in the hospital? Most of the antihypertensive drugs used by doctors are to dilate blood vessels. The blood vessels are passively expanded under the action of antihypertensive drugs. After a long time, the blood vessels get tired and they want to return to their original state. If it really returns to its original state, the blood pressure will rise again. 在医院是怎样治疗高血压的呢？医生们使用的降压药啊，绝大多数降压药的作用是什么呢？是扩张血管。血管在降压药的作用下被动扩张，时间一长啊，血管就累了，就想回到原来的状态。如果它真的回到原来的状态的话，血压就会再次升高。Therefore, in order to keep the disobedient blood vessels in a dilated state, we can only increase the dosage of antihypertensive drugs. At the beginning, it is enough to take half of a tablet of antihypertensive drugs every day. After a long time, the dosage should be increased to 1 tablet, and if not, it will be 2 tablets. If it still doesn't work, replace the drug with more effectiveness. If it doesn't work, several drugs are applied to combination. The purpose is very simple. That is, to keep the blood vessels in dilated state. 所以呢，为了让这个不听话的血管继续保持扩张状态，就只能增加降压药的用量。一开始每天吃半片降压药就行了，时间一长，就要加量到1片，再不行就到2片，还不行就换药力这个药效更大的，再不行啊，这个医院的医生就用好几种药联合起来使用，目的很简单，就是让血管始终保持扩张状态。Blood vessels become very exhausted, and over time, some components of the blood vessels wall will change, even disappear. 血管变得很疲劳、很累，长此下去就会导致血管壁一些成分的状态改变，甚至消失。Okay, so see you in the next lecture.